Hey tribe, I'm so thankful that you have joined us today. We are going to talk about nurse resilience, burnout, and compassion fatigue. Thank you for joining us, Karen.
Hi, thanks for having me.
Yeah, so Karen is a nurse, and she also has started the the Resilient Nurse Project, and she's helping us overcome burnout and compassion fatigue. And I'm so excited to learn about that and what she's doing. And she's also part of the IV team at a big children's hospital, and she serves over multiple populations in that hospital. She's been a nurse for over 14 years, and she has lots of experience and knowledge to share with us. So I'm so thankful that you've come to us from Atlanta. So welcome.
Thank you. Very
Would
excited to
you,
be here.
yeah, would you mind introducing yourself? Whatever I didn't cover, whatever you want to share, just tell us a little bit about you.
Yeah, so like you said,
Uh-oh. We lost Karen. Whoopsies. There she is. That's okay. You're back.
okay. Not sure what happened there. So I am in Atlanta. I work for a large children's hospital. We actually have 3 hospitals in our system throughout Atlanta, all pediatrics. And through my 14 years, I've worked in pediatric ICU, neonatal ICU, cardiac cath lab, and then I've done some like utilization review, prior authorization on the kind of insurance side of things, and then the IV team, vascular access team. So
That's awesome. So I like to do an icebreaker. I'd love to hear your funniest nursing story.
okay, so I actually have 2 that I kind of thought of. So I'll tell you one from when I was doing as a clinical instructor. I have taught in an LPN school and a bachelor's program. But in this LPN school, we were doing we were going in to work with this elderly man who was severely constipated. And we had given him Miralax and, some other things. And so we went in to help him be successful with our results, right? So his wife is sitting in the corner reading her book. And this poor man is cramping. He's like, I'm ready to go. I need to go. So we get up. I have these 2 nursing students who are scared to death, because they were new in the clinical arena. And so we're all trying to be professional. But this man gets up out of bed and takes his gown off. He's completely naked. And he's kind of cramping around, like dancing around to the bedside toilet. And he's like, oh, I've got to go. I've got to go. And we're like, okay, just turn around and you can sit. And to put it nicely, the pressure, I guess from all this buildup, was pressing on his bladder.
Uh-huh.
So here he is. He became like an out of control fire hose, and so he's trying to use the bathroom, but you can imagine he's just peed all over the place. And we're trying to be professional, but obviously having a very hard time maintaining this while we're dodging this fire hose. And his wife is over in the corner cracking up. And when she started laughing, we all just busted out. It was just like the tension. It was hilarious. So just everybody tried so hard to like not laugh, and we're all just crying. So that was one of my funniest memories in trying to teach nurses, how to be professional. But sometimes you just have to laugh.
That is so funny. That is amazing. That's a good one. So when did you realize you had a passion for helping nurses be resilient and resist burnout?
So I had been a nurse for about 8 years when I kind of realized that this was affecting me. And to go back a little bit, I became a nurse sort of out of practicality. My mom was a nurse, and I was a single mom with a toddler and another baby on the way. So I needed a career that was going to support my family. So I said, okay, nursing worked for my mom. I'm going to be a nurse. And I liked it, but it was just what I did as my job. And I heard people talk about burnout and compassion fatigue a lot, but I just kind of thought it's just part of the job. This is what happens. I started in a pediatric ICU. So in an ICU, you're going to be stressed, right? And then my youngest daughter in 2014, who was 9 at the time, was diagnosed with brain cancer. And it hit us like it was a complete shock. I had no suspicion. There was no hint that anything was wrong, more than just I thought she had a stomach virus. But so we find out she has brain cancer, and I realized I was so tired emotionally, mentally, physically from caring for everybody else's children over these last 8 years,
Mm-hmm.
I didn't have anything left to give her. And the thought of having to care for her as a mom and a nurse, I just was like, I don't know how I'm going to do this. I'm gived out, right? I'm already empty. How am I going to double down on this for my own child? And that's when I really realized that burnout was something that I couldn't accept, and that I had to figure out a way to address it.
Yeah, absolutely. Wow. I'm so sorry to hear about your daughter. She's okay?
She's doing great. She's 6 years in her mission. She just actually started her first job last week. She's 16 now. So yeah, she's doing amazing. Thank goodness. She is. It was a hard journey, but she's doing great.
Wow. That is amazing. I'm so thankful to hear that.
Yeah.
So what did you do prior, and how did it prepare you for your road down helping nurses be resilient?
Yeah, so I, like I said, had been a pediatric intensive care nurse, and that was the work I did up until she was diagnosed. And that's actually when I switched to the utilization review and prior authorization so I could work remotely and be with her during treatment. But during that time, just talking to people, talking to my mom's friends that were fellow nurses and her colleagues, and then my own nurse colleagues, was always kind of asking questions about, what do you do to, take care of yourself on your days off? How do you deal with the stress of the ICU, and especially pediatric ICU, when you see such horrible things sometimes, and you can barely catch your breath before sometimes it's time for the next hard thing to hit. So I was always kind of asking people and just cataloging those in my mind. And then when my daughter got sick and I realized this is something I have to figure out for myself, I really started to dig into research about resilience theories and different practices that people, not just nurses, but people in other difficult jobs like Marines and Navy SEALs, what they do and how they teach people to build that resilience and to deal with the stresses without being burnout or without being a casualty of that career.
Yeah. Is there specific training for this? And you said you did research, but did you have any specific formal training?
No, so I did complete my master's in nursing education in 2019. So through that, I kind of learned how to teach people, especially adult learners, different techniques and different strategies, and learned about different learning techniques so that I could convey the message. But as far as teaching resilience, there really isn't a lot of good training for nurses. And that's one of the reasons I felt so passionate about doing this. I realized through my master's program and teaching in a classroom setting, nursing schools already are so tight for getting all the curriculum in. There's no way they can make room for something that's a soft skill like this, that's not needed for bedside nursing, right? It's not something you're going to do for your patient. And employers don't a lot of times have the funding or don't put the funding towards something like this. They feel like it's something that people just need to figure out on their own. And that was really frustrating to me. So there's not a lot of particular specific education for this topic, which I think is unfortunate. And so that's why I'm trying to fill that gap for nurses so that they can be taught how do I figure out how to just do this every day, and deal with the emotions of the struggles and figure out how to balance, how to be my best at work and still be my best at home without feeling like I can't be good for both.
Yeah, agreed. So when you took a break from the pediatric ICU, or left the pediatric ICU, I should say, and went to utilization review, did you have some sort of processing that happened? Did you realize that you were burnt out? What was your experience like?
Yeah, so it was interesting when I talked to a lot of people that were in that role. A lot of them had come to that more of away from the bedside, kind of behind the scenes role, because they were so overwhelmed and burnt out in dealing with their patients every day and with the, all the demands of a clinical role. And that's where I really started to realize that it's unfortunate that people feel the need to just give up on something they're passionate about because they're overwhelmed, and so that allowed me to kind of see it from a different angle. That number one, some people left their role because they felt like they didn't have the tools to manage it, but also it gave me kind of a sense of hope that there are different career options for people who need to take a step back from bedside, that you can still use your skills and be valuable in a different way.
Yeah, absolutely. I totally agree. I'd love to share my story of burnout and what that looked like for me because I think that so many of us experience it, but it looks so different.
Hmm.
So it sounds like you were pretty acutely aware, like, okay, I can't do my baby being in the pediatric ICU and working in the pediatric ICU and living some sort of life outside of work. I can't do all of this. I had an experience where I didn't really realize I was burned out. I was taking every patient home with me, every single one. I was an anxious mess when I was at home, worried about said patients,
Hmm.
worrying whether they were going to get good care, worrying if the nurse was going to catch X, Y, and Z. And I had no bearings for any of these feelings. The team I was working with was phenomenal. They were absolutely like the best team, if not one of the best teams that I've ever worked with in my career as a pediatric ICU nurse. I had been doing it for 13 years, actually 12 at the time. And my husband was like, why don't you look for something else? And I was so insulted. I said, I'm a pediatric ICU nurse. What do you mean look for something else? This is
Right.
who I am. Someone asks you, well, what do you do? And you say, well, I'm a pediatric ICU nurse. And they're like, wow, and
Yeah.
so you kind of get used to this feeling of this is who I am, this is what I do. And so all of a sudden you're not that, and that feels weird. And so when I started putting in applications, it took me about a year, honestly, from the time when my husband said, I think it might be time for you to step away from the pediatric ICU. And I was insulted initially. And then
Right.
after a lot of processing and prayer, I finally was like, okay, maybe I do need to step away from the ICU. So I submitted some applications for case management. And when I got there, I was like, I hate this. I
Mm.
absolutely hate this. I hate this. I hate this. I loved the pediatric ICU. Why did I leave what I loved to do something I hate? And so I told myself that I had to give myself 6 months to process and a year total being there to really feel comfortable in what I was doing. And lo and behold, like I truly love nursing. It wasn't
Mm.
just that I was a pediatric ICU nurse. I love nursing. And now it's so nice to know that just because the PICU or the ER or med surge isn't for you anymore, that doesn't mean you don't like it. That doesn't mean you're
Right.
not a nurse anymore. That means that you can have a change of scenery and still fulfill your role as a nurse and really help people. So that's my story. Thank you for allowing me to share.
Yeah. And I think that's something that people, often we guilt ourselves into feeling like you failed if you have to just change or step away, but that's not the case at all.
Mhm.
There are seasons of our career for a lot of us, just like there are seasons in life, and there's a time to serve in one area, and then there's a time to take those skills and serve somewhere else. And that's not a point of failure or not being good enough or not succeeding. It's just a change in seasons and in the times in our life. And so I think we have to change our mindset, that it's okay if you feel like this isn't for me anymore. It's time to kind of look at a new avenue. And that's one of the greatest things about the career of nursing is there are limitless avenues within nursing that you can explore. And I think, like you said, so many people have a story, but they don't even realize that it's burnout or that it's compassion fatigue. They just feel like either, why am I so tired all the time? Or my kids are so stressful, or it's just, this is just how life is. And it doesn't have to be that way. But I think sometimes we're so busy taking care of everybody else and their problems that we just accept that ours are not important or not, are not prioritized. And that's, it's unfortunate because, we're the nursing force, and there's 2.86 million nurses in the US.
Wow.
And if even half of those, or even 30%, the latest report I saw said 30 to 40% report feeling burnout. That's still a humongous number,
Yeah.
and that's way too many people to be suffering. And it's just not necessary. It's just a matter of, kind of changing our mindset and learning how do we leave those things at work? How do we deal with those emotions and the things that we see and work through every day?
I agree. And in the moment, I felt so alone. Like I didn't really have the words or the emotional capacity or awareness, maybe,
Mm-hmm.
to process what I was feeling and talk to someone about it. I wasn't really at a place where I kind of just felt alone, like, well, this is just normal. Like, I didn't really feel like it was anything out of the ordinary. And
Right.
my husband was the one who brought it to light and was like, this isn't healthy, you know? But he had been with me from the beginning and watched me increasingly more anxious and bringing more of my work home, etc. And so he was aware of it, and I was still clearly not.
I think a lot of people find that, their fellow nurses don't always catch it early on because we're all immune to it. We all just have that suck it up and move forward kind of mentality, most of us. And so sometimes it takes somebody from the outside to say, this is not how work is supposed to be, no matter how intense your work is, it shouldn't affect you to this degree. And so I think a lot of people find themselves in the same position that you did.
Yeah. So how do you personally help nurses with resiliency and burnout and compassion fatigue? Do you have like specific action items or tips that we can use?
Yeah, so actually through the Resilient Nurse Project, I have a course that helps teach nurses the 6 pillars of resilience, which is what I kind of found and developed through my research, that there are 6 different areas in your life or in building resilience, 6 different kind of angles that you can tackle to build this holistic resilience that will sustain you through more than just a situation. Or just more than a one time, I'm going to go home and take a bath and have a glass of wine and feel better tomorrow. Sure. But it's building a more long-term resilient personality or resilient kind of conscience that helps you manage all the stressors that come with being a nurse. So our course is one of our biggest things. And then we also do retreats, which are on hold right now due to, COVID and all the travel restrictions. But we do have retreats that are like a long weekend. We have speakers come in and talk about different things that nurses struggle with, sleep, nutrition, things like that speak specifically to that area for nurses. So how, for example, how do you balance nutrition when you work night shift, but you also, you're up all day taking care of your kids? What do you do? Eat breakfast, lunch, and dinner twice in that 24-hour period? That's not good. So we have different specialists that come in and speak during the retreats. And we're working on building a membership to kind of help build a community. But right now we have our Facebook page, that's the Resilient Nurse Project, where nurses come and build community and just talk about the things that help them be resilient, deal with the day-to-day stressors of work, and what people are struggling with.
Awesome. Can you share any of those action items that we might be able to actually put forth as the Tri-Bar community?
Yeah, so one of the biggest ones is, like we talked about, is having somebody to talk to, but somebody who understands both inside and outside of nursing. So it's important to have people in nursing who understand the stressors that you deal with, like seeing patients at their worst or dealing with, in pediatrics, one of the hardest things is dealing with parents when their child passes away or has a traumatic event. Not only are we dealing with our patient, but with their parents. And so having somebody else who understands those stressors is really important, but then also having someone outside of that world who can kind of see outside of that, like your husband did, to see, okay, this is more than just stressed about the situation. This is overwhelming or taking over your day at work or over, your ability to deal with the day-to-day home responsibilities. Yeah. So having that support system is one of the things that's really, really important to build up and to have a conversation with them to say, you are part of my support system to help me deal with this, to let them know like this is an active thing that is important in helping you be successful. Another thing is active education and helping secure our ability to make confident decisions. And so one of the things a lot of people talk about in the workplace that causes stress and anxiety and overwhelm is not always, being able to make a critical thinking decision or deal with something one-off that comes up that's not part of the everyday routine. And so we talk a lot about how do we do continuing education, not just the stuff we have to do to check off our box, right? Or that our employer requires us to do, but how do we continue to better ourselves and improve our own thought processes and our knowledge base, so that we have more to pull from when we're in a critical situation and we have to make a confident decision in a moment. So things like crucial conversations and, dealing with parents or patients or family or colleagues that, when you have an awkward or tense conversation, how do we deal with those things? So we talk a lot about recognizing where we can increase our own education and knowledge base so that we have more to pull from in our day-to-day work.
Those are great points. So in your work with the IV vascular team and with the Resilient Nurse Project, what do you love most about your career as a nurse?
I think the thing I love most is, it's twofold. Number one is, obviously the patients that I deal with, seeing the long-term impact, I still keep in contact with some of my patients who developed, special bonds with, and seeing the impact of their life 10 years down the road because of something that I did. So one of my first patients as a new grad was an 8-year-old who had a stroke. And he was the first child I ever extubated. I still remember I was so nervous, but still here we are 15 years later, and his mom sends me updates, and now he's in college and doing great. So, making those type of relationships and seeing the impact that we can make in a person's life is really great. And then the other thing is my colleagues. I love the people that I've met along the way, because nurses are a community and a group like no other. The amount of caring and compassion that we have for each other is really special. And I love all the people that I've met through my different jobs as a nurse. They have, blessed my life in so many ways. And I'm really so thankful for them.
I couldn't agree more. I'm telling you, like, seriously, the nurses that I've had the opportunity to meet and work alongside, there's nothing like running a code next to somebody and knowing that they have your back. It's a different profession, and we're so fortunate. So there haven't been questions come in. If nobody has questions, then we will close out with your favorite nursing hack.
So my favorite nursing hack, refers to vascular access. So one thing people are asking all the time for IV skills help. And one thing that really makes a big difference that people don't often think about is heating up your vein before you stick it. So if you use a warm pack or even a warm blanket or even friction, like if you don't have a warm pack, just rubbing for a minute, because heat dilates the vessels. So essentially you have a bigger target to hit. And so even if you just take a few minutes to heat that vessel with whatever you have available, it's really going to make a big difference in your success.
Absolutely. I love that tip. That's a great one. So I appreciate your time today. I appreciate you tuning in with us. Those of you that viewed, have a happy Memorial Day, if that's kind of an oxymoron. But anyway, to all of you who have served and continue to serve our country, I appreciate you. And Karen, thank you so much for tuning in.
Thank you so much.
Your time. Have a great day, tribe.
Bye.